We will have to confront choices that no doctor ever wants to make and no family ever wants to hear. They will be choices about who will get the care they need and who will not. There'll be choices about who receives oxygen or is transported to hospital. Decisions we are already seeing being forced with ambulance crews in California, where the virus has spread widely. And I want to emphasize that the choices will affect all patients needing intensive care. Whether it's patients who have a heart attack, who've been in a motor vehicle accident, who have COVID-19, are now affected by COVID-19 outbreaks. And as the virus spreads, so will the outbreaks and so will the deaths. The number of Ontarians with COVID doubles every 35 to 40 days, roughly every month to month and a half. But this new variant, if it spreads, will mean that the doubling time for cases could drop as low as 10 days. Now, the vaccine, and this new variant is not more lethal. But because it spreads so much more quickly, if it gets out into the community, there is no question that we'll have more cases and many more deaths. People will die from the virus itself and from an overloaded health system that is unable to respond to their needs.
That is Dr. Staney Brown, the co-chair of the Ontario COVID-19 Science Advisory Table. There's a news conference underway at Queen's Park. It's just coming to an end. Those were his opening statements, sort of the overarching picture, and then going through all those slides. Should note also, Barbara Yaffe spoke just after 12 o'clock. She's the Associate Medical Officer of Health. So with respect to what is known as the variant that was first observed in the UK, there are now 14 cases confirmed in Ontario, 8 new ones, and she said 5 of them are related to a UK traveller, and that public health is currently still trying to determine where those 3 new cases are from. There's an awful lot to talk about. We're going to let you listen again, because sometimes, this is, you be the judge of what you're hearing. The gravity certainly is there, and our guest, as I mentioned in the introduction, is Dr. Peter Jüni. He is one of a trio of specialists leading Ontario's COVID-19 Science Advisory Table. This is a group of some 35 experts, and the gentleman you just heard, Dr. Staney Brown, is one of the co-chairs, so I guess in effect he would be your boss. Dr. Peter Jüni, welcome to the program. Welcome back.
Thanks for having me.
So you've been looking at this stuff close up. You've been building up to this day. Even when you hear it, you hear Dr. Brown say it publicly. What are you thinking about? What are you feeling when you hear it?
Look, we're at a watershed moment, and I may have said that before. The problem really is things are really worrisome right now. It's really challenging, and we just need to do the right thing. We fared relatively well compared with the rest of the Western world, Western Europe, the US, we fared relatively well. Luckily, except for Norway and Finland. If we want to keep that this way, we now need to really act strongly.
Mm-hmm. And well, I should note that at just after 1 o'clock, the province will reveal ultimately what it decided on new measures. I think our audience has some good questions about that. What else would you want to highlight that maybe hasn't come through yet for our audience? They've just tuned in. They're hearing this. What else would you want to draw some attention to?
Look, what I always hear, or not always, but quite frequently hear is, why is it not working? Why are the measures that we're taking not working? And I think it's really important to absorb now and forever. The measures are working. If the 2/3 to 3/4 of people who are actually adhering to the measures wouldn't do their job as well as they do, we would be in real trouble. And to put numbers to that, we can do very simple calculations that are really rock solid, just based on what we experienced in other jurisdictions for the second wave. So this is not just some fantasy, that's a reality. If we just all went back to normal, those 2/3 to 3/4 of people who take it seriously and who help, if they all said, we go back to how things were in February, February 2020, we don't care anymore, we go out, I hug the next of my friends, etc., I meet at home, etc., etc. What this would mean is that within 6 to 8 weeks, 10 million of the Ontario population would get infected, or probably 11 million, until we are at roughly 80%. This would mean within 6 to 8 weeks, we would have roughly 50 to 60,000 deaths just because of COVID-19. This would mean we would have at least 150 to 200,000 people who need to be hospitalized for COVID-19. And this would mean that we would have at least 30,000 people who needed an intensive care unit bed that would not be available. Only because so many people do their jobs well, this is not happening.
There's so much here too. I'd like to maybe get you very quickly, if we can, and we will go to the phones. I have another little bit to play. We'll try to do that. So again, this is sometimes good listening. People don't have time during their day maybe to sit or stream live this, so we'll let you hear as much as we can of what was being demonstrated at Queen's Park at that news conference with public health officials. But Dr. Jüni, one of the things that Dr. Brown said, people essentially have kept moving around at the same pace, just like at the lowest point of the pandemic in July.
Yeah, that's a problem. That's a real problem. We see that based on anonymized mobility data, from our smartphone data. We see that people keep moving and they just move too much. It depends on where you are just in the season. If people are able to stay outside, then mobility can be a bit more, contacts can be a bit more, and still nothing happens. The problem is now we have moved inside because the weather is miserable and cold, and now we can afford even less. Meaning the threshold, for things to go well in July were not as difficult than the threshold for things to go well now. We need to get better, much better than in July, to keep the thing under control.
Okay, I'm gonna invite my colleagues in the studio to play a little bit more of Dr. Brown. In an instant, I'm going to give out the number 1-888-817-8995. We have Dr. Peter Jüni with us. He's the science director of the COVID-19 Science Advisory Table. Dr. Brown is the fellow who sort of kicked off that news conference. Here he is. I sort of labeled this loosely as kind of like danger by the numbers. Take a listen.
Growth in cases has accelerated and is now over 7% on our worst days. Almost 40% of long-term care homes have active COVID-19 outbreaks. Since January 1st, 198 long-term care residents and 2 long-term care staff have died of COVID-19. And our current forecast suggests that the deaths in Wave 2 in long-term care will outstrip those in Wave 1. COVID-19 ICU occupancy is now over 400 beds. Surgeries are being canceled, and the access to care deficit will continue with real consequences for health. Much of this is due to the fact that mobility and contacts between people have not decreased with the current restrictions. Survey data do show that the majority of Ontarians are helping limit the spread by following current restrictions. However, case numbers will not decline until more of the population follows their example.
Again, that's Dr. Steny Brown. Dr. Peter Jüni, before I go to the phones, maybe I should invite you to also clarify just the situation in the ICU. There's some really troubling numbers about that.
Yes, you see, we are at a point now where people who would need to get their heart surgery, for example, can't get the heart surgery anymore because the ICU beds are occupied by patients who need it because of COVID-19. And this means these patients who urgently would need operation stay on a wait list, and it's well known that if you stay on a wait list and if you delay that too long, you actually will potentially die of your heart disease. And that starts to happen, we know that. And we've seen that before and we see that again. That's a tragedy in itself, and that's just, some of the very tragic byproducts of this pandemic, stuff like this.
Yeah, one of the things that Dr. Brown highlighted too is for people to consider if the room is shrinking, if there was a car accident, if there's like a catastrophic kind of event, even a domestic situation, there's no room. Let's start going to the phones. Lots of questions. Mark, you're in Toronto. I don't know, what are you thinking as you hear some of this being laid out of where things are at today in Ontario?
It's an embarrassment. Like, we've known for months the second wave would actually come and fight us on the bum, excuse the expression, and we knew this was going to happen. And now we're sitting here, we're saying, we all have to make ourselves, seclude ourselves again from everything that's important. And my issue is with this whole thing is that we have a government that keeps constantly saying, hey, the numbers are going up, see you next week. And I feel that it's a failure, and I feel that our health table has failed in this way because either the government's not listening to them and saying, look, we've been at over a 5% positivity rate for months. Experts have agreed 2.5% is the way to go. We also have tons of exceptions going on right now, and who's essential and who's not. Construction, unless it's for hospitals or for infrastructure, is not essential. But we have all these construction crews working in very close quarters. There's no way you can avoid it when you work on construction sites. And I work on construction sites. So we have a problem where we have this economic impetus that is driving this virus. So it's a failure. And that's where I'm at right now. And I'm frustrated because even though I've been abiding by all the rules, I don't blame individuals. I blame the fact that the system itself has not been effective in stopping this, that we have not been listening to the experts.
And before I let you go, Mark, and let Dr. Uni comment, I'm just curious, you say you work in construction. This is one of the areas that there is a possibility that some changes. Do you think, are you prepared to slow down or stay home in your field?
Oh yeah, I mean, for us, it's like, the fact is that a lot of these guys are working construction sites. If you say no, you can't work. There's no support for you. So we are not giving workers the opportunity or the option of actually not working. So we have created a situation where people are considered essential, therefore they cannot get any kind of financial help to actually take off. And then these guys are bringing it home to their families. You have no idea what construction sites are like. If you've never been on a construction site, you have no idea how hard it is to keep clean and keep socially distanced. And you can look, just go walk by a construction site and see what's going on. The work is heavy. It's very close quarters, particularly when it comes inside, when you're doing work inside, renovation. And that stuff was actually considered exceptions. You could renovate in someone's house. And I've seen crews where you had 5 or 6 guys working in the house, and that's way too many people working in one individual space.
Okay, I want to let Dr. Uni jump in here, Mark. I appreciate your level of concern and also frustration. Dr. Uni?
I completely agree with you. Workplaces are a real issue, and we need to get extremely a lot better with workplaces, including construction sites. I do not agree with you that we're a complete failure. If you want to go and watch complete failures, go to my home country, Switzerland, for example, go to Belgium, go to the US, that's complete failure. This is a really difficult situation, and it's much more difficult from, when you are actually inside than from the outside. All of these measures have negative effects, and you always need to find the balance. And elected politicians don't only have the scientists to listen to, but also other people. I was much in favor of finding a differentiated way of dealing with this, in different parts of the province, depending on the transmission rates, etc., etc. One of the challenges we have.
you take it into her side. Over the hills and far from home, she's waiting for love to be realized. I'll send her my heart covered as a gift, and hope that you'll take it into her side. La 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 la. La 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 la. She's waiting for love to be realized. I'll send her my heart covered as a gift, and hope that you'll take it into her side.
10公里的比喻，25公里的比喻。那时，中国好比一个童女，拿着灯出去迎接新郎。 其中有我们是医学的，我们是医学的，医学的大学生是实际中国，万一有人想说，
over the hills and far from mine. She's waiting for love to be realized. I'll send her my heart covered as a gift and hope that you'll take it into her side.